Want to share your screen? Oh, okay. Okay. Good evening, everyone, and welcome to this evening's webinar on traumatic brain injuries, an overview of clinical and social support. Before we get started, I'd like to introduce myself. My name is Taryn Katusian. I am the Associate Director of Alumni Engagement here at St. Joseph's College, Long Island on the Patchogue campus. And on behalf of the college and on behalf of the Office of Alumni Engagement, I'd like to thank both of our presenters for being with us this evening. Dr. Lucianna Basilice-Tieniber, who is our Director of Student Accessibility Services at St. Joseph's College, and she's also the Director of Program for Access and Student Success, our PASS program. And we also have Dunne with us from the class of 2001, proud alum of St. Joseph's College. And in addition to supporting individuals in this population in a full-time setting in a professional atmosphere, Ira is also the founder of The Social Brain, an amazing new nonprofit that's brand new for Long Island, which Ira will tell you a little bit about later on in this webinar. Before we officially get started, we just want to let all of you know that there's going to be a lot of information that we're going to share with you, so you may want to hold some of your questions until later on in the presentation, but you can ask questions anytime that you'd like by typing them into the chat box or by raising your hand. Also, if you have any problems seeing or hearing us, please feel free to let me know that as well. Thank you both for joining us, and we're so excited to have you get started. Thank you again.
Hi, everybody. My name is Lucianna Basilice-Tieniber. As Tara said, I run the Student Accessibility Services Office at SJC. The big thing that we have is the PASS program. We cater to the traumatic brain injury population. So we are very, very excited that this topic is now being discussed, and we thank St. Joseph's College for allowing us to do this. Take it, Ira.
Hi, my name is Dunne. I'm a proud alumni of the college, 2001. I have worked in the traumatic brain injury field for over 10 years now, and recently, about a year ago, I've had the privilege of working with family members, survivors, and other professionals to found the new Social Brain. It's a new nonprofit here on Long Island for brain injury survivors.
Okay, let's get started. So today we're going to be discussing, obviously, traumatic brain injury, understanding the impact of TBI, awareness of TBI, at-risk populations, living with TBI, rehab for TBI, supporting individuals with TBI, and resources for TBI survivors, families, and professionals. So before we get started, let's just get a quick anatomy lesson. Sorry, guys. Oops.
The cerebrum has 4 major lobes. The frontal lobe is situated anterior to the central sulcus. It is associated mainly with voluntary motor functions, planning, motivation, emotion, and social judgment. Posterior to the central sulcus is the parietal lobe. This lobe is mainly concerned with sensory functions of the somatosensory category, such as touch, stretch, movement, temperature, and pain. The temporal lobe is separated from the frontal and parietal lobes by the lateral sulcus. The temporal lobe is associated with hearing, learning, visual memory, and language. The occipital lobe is located at the rear of the cerebrum. This is the visual processing center of the brain. At first glance, the two hemispheres look identical, but research has found a number of differences between them. This is called lateralization of brain function. For example, the language formation areas, the Wernicke's and Broca's areas, are usually located in the left hemisphere of right-handed people. Lesions to these areas result in language comprehension deficits or speech disorders. The corresponding areas in the right hemisphere are responsible.
Okay, so getting back to it. So now that we've had our brief anatomy lesson, majority of the TBIs occur in the frontal and temporal lobes, which, as you saw in the video, affect mostly the way we cognitively function, the way we hear, the way we see, the way we process. So what is traumatic brain injury? Let's get into it. So according to the DSM, you have to have one of the following: loss of consciousness, post-traumatic amnesia, disorientation and confusion, and worsening pre-existing situations such as seizures, cognitive issues with the Ed, attention, memory. If you exhibit one of these, you could be considered a TBI. So major versus minor. Now, many people think that when they get a TBI, it is automatically major. This is not true. A minor or severe, modest one could be considered a concussion, whereas let's say you have a major car accident and you hit your head pretty badly, that could be a major traumatic brain injury. So regardless, it could affect the following areas: executive functioning, which is how you process everything; complex attention, basically how much attention you give to each specific task; how you learn and how you remember; your language, how you think of what comes out of your mouth, or being able to even have the words for it to come out of your mouth; your perceptual and motor; your social cognition, so being able to socialize with other people; and basic life skills. So having a TBI could definitely interfere with your ability to be independent. So please seek out support. Let's look at the stats. Now, these stats are from 2014. I'm sure that they have sadly increased. But as you can see, back then, there was 2.87 million TBIs in the United States. About 800,000 of those, or a little more than that, are children. And because children are a little more reckless. Ages 21 and under are at the greatest risk because, again, they're a little daring at that age. So the sad number here, besides all of them, is the 56,800 TBI-related deaths. This is a very serious topic, and it is happening more frequently. So how do brain injuries occur? A DUI accident, a DWI accident, motor vehicle accident, so drunk drivers hitting other people, let's say your motorcycles, anything of that nature. Bike accidents, people don't wear their helmets, you need to wear your helmets. People who fall, criminal behavior. We've seen things such as the Boston Marathon, where they had makeshift bombs. They exploded and that caused a lot of injuries. Domestic violence, if you have abusive people. Sports concussions is a big one, especially with football players. We'll get into that later. Blast injuries for military and combat injuries for military because of IEDs. So, Ira, why don't you talk about anoxic?
Anoxic brain injuries are when there's a loss of oxygen internally. There's no full blow to the brain or the skull or of your head. It's more now just an internal medical concern. Some of them include strokes and aneurysms. Some include drug overdoses, when a lot of these children and our teenagers and college students out there now are into, the opiate issues and the drug overdoses. Many of them can cause brain injuries by overdosing and then losing oxygen during an overdose. Alcoholism, when people have drank so much that they are what is called an alcohol-induced brain injury, or wet brain, as a nickname is called, wet brain, where they've actually drank so much that they've actually burnt their cells away during their drinking years. Attempted suicide, it is a sensitive topic, but it is a topic that is included in anoxic brain injuries, where it's not when someone wants to attempt, but it's in the midst of attempting, and then something happens and the family jumps in to save them, but however, they've already lost some oxygen loss. And a rarity, but it is still out there, is an allergic reaction. Many individuals that have severe allergies have what's called an EpiPen. If they do not have an EpiPen that's available, they can go into anaphylactic shock and lead into a coma. That's why it's so important for people who have allergies. Know your allergies, know your reactions, and make sure you carry your EpiPens when needed.
Another one to add on there is texting. Okay, everybody hears about texting while driving, texting while walking. I don't know how many times I see kids, 2 words, Pokemon Go, where they're not even paying attention to what's going on around them. They're just so wrapped up in the phones. And they fall up the steps, they fall down the steps. So please be cognizant of where your surroundings are when you are texting or being on your smartphone. So let's get into the cognitive. Cognitive is how you think. So when you have a TBI, your memory is affected. You may not be able to remember things that happened 5 minutes ago. You may not remember your surroundings. You may not be able to remember how to process information. Any attention that you were able to give to a certain task may take a lot longer with a lot more repetition, because again, that part of your brain has been affected. Back to decreased memory. You're missing a part of your brain, or a part is damaged. You may not necessarily be able to have that memory back. The way we process information. We process information in very unique ways. When there is disorientation within our own brains, we can't process information the same way we did at one time. So overall, with all of these different factors, it equals executive dysfunction. So we are no longer able to make executive decisions as efficiently as we did prior to TBI. So the next is the physical. Headaches, nausea, sleep disturbances, visual changes, mental fatigue, physical fatigue. I had a student who was in my office. She was wonderful, and she is a very successful graduate. She was TBI. She was telling me what it took for her to complete her assignments. After 30 minutes, she would get a migraine and she'd have to shut off the lights and she would have to just gather herself. Thinking was excruciating. She was constantly feeling nauseous. She did not sleep. And as a result, she was just always physically exhausted. But kudos to her, because she graduated top of her class. So these people can definitely go on once they have the right support. So Ira, why don't we talk about the social?
Understanding the impact of a traumatic brain injury. Social emotional components are the same or as most important as just as the physical is. Many times they're sitting at home, they're by themselves, they're a college student or more, they're elementary school teacher who taught all those fifth graders for multiple years, major car accident over the school summer, and now she can never go back to her classroom. Accepting of herself. You have an EMT who is an ambulance driver for multiple years. She has an aneurysm, and now she's in the back of the ambulance that she was a driver for, and now has to raise her 3 children by herself and learn how to accept herself as well. So there's a lot of different things that go into the social components. You have depression of why can't I go back to the way I used to be? Why did all this stuff happen? When somebody is sick and somebody is not feeling well, you gradually understand the changes. Or if somebody's born with autism or a different developmental disability, they gradually learn how to cope and learn how to understand, go to conferences, teach themselves, and learn. When there's a traumatic brain injury, an instant traumatic event of a car accident, of a fall, an instant stroke, the whole world stops, frozen in time, and now everything must be relearned all over again. There's a lot of confusion, impulsiveness. We were talking about before when we talked about the anatomy, the impulse mechanisms are often, the impulse mechanisms in the brain are often affected by the areas of what was hit, which then leads right into aggression. They can't compromise, they can't cope, they cannot problem solve, which then leads into the aggression as well.
Well, and understandable that you would be frustrated to encounter all these different things. And I had another person who I knew who was in a car accident. She was walking across the street and she was stuck in 2011 for the rest of her life because she couldn't get past that. So to watch her every day and have to remind her every year that it wasn't 2011 and seeing the expression on her face was heartbreaking. So these people are dealing with a lot. So the growing awareness of TBI. We could thank our military service members and our athletes for really bringing this to the forefront, because it was always there, but until we had mass media focusing on it, we weren't really talking about it too much. So who's the greatest at risk? Before, as I said, 21 years and under. The military service members, they're going into hostile environments, the training they're going through, the physical stamina they have to have. These are very dangerous situations that they are being put in, and they are at risk more so than most people because they're in these areas that there's a lot of violence. Athletes, Muhammad Ali, concussions, football, all these things that we think about are actually TBIs. We just refer to them as, oh, it's a concussion, but that is actually considered a minor TBI. So thank you to the athletes. Elderly, pretty self-explanatory. I think of my grandmother. My grandmother was a very, very active woman, and she still is. She was walking up the steps, lost her balance, fell down, cracked her head. She's okay. But just goes to show you, it was just a quick slip and she was in the hospital. But again, okay. At-risk drivers. People don't think. People are texting while they're driving. You tell them really upset about this texting thing. And they're not necessarily paying attention. They could be using drugs. They could be doing alcohol. So these are all people who are at risk. So before I get into this slide, I just want to give a shout out to Erin Diletto, who is the Director of Military and Veteran Services at St. Joseph's College. She was kind enough to provide us with this data. So getting into it, men between the ages of 18 and 24 are at the greatest risk. As I mentioned before, they are doing training exercises that are very physical. They are being deployed to places that there are a lot of violence. There's suicide bombers, makeshift bombs. We see this when we're not even in the military. The good news is the VA has recognized that there is a need and we need to provide resources for these individuals as they transition into becoming veterans. The largest increase of TBI is seen in the elderly. Again, these people were very, very active at one time. It's hard to come to grips with, I don't have the ability to be as active. So when they're trying to be active when they really can't be, it could lead to falls. It could lead to other disability related issues. If you can't see, if you can't hear, these are also impacted. And let's just look at the statistics. So the Army sustains the most traumatic brain injuries. And just to look back, the highest peak for all the divisions was in 2011. We were dealing with Iraq back then. So you can see there's a slow decline, which is a good thing. But because the Army is always in the trenches, they're usually going to get it the worst. Athletes. Go ahead, Ira.
Athletes are a very big concern now because athletes are moving down to your high schools, even your younger children down in the community areas of sports, your PAL leagues, your local karate schools. Anything that has an athlete in it needs to focus on the concussions. Multiple concussions can lead to a more severe TBI down the line. It used to be where, years ago, the kid would get hit and they'd sit down, they'd rest, maybe they rest for one game and they'd be back on the field by later that day or the next day. Now many sports teams and schools and colleges have concussion programs, concussion management. They need to be cleared by the doctors and they have to be cleared, by the sports athlete directors to return back to the field. Not wearing the most protective gear. Could be in sports, could be on the field, as we see here. This is a boxing picture here, but it can go to any sport possible. And I also put my plug out there for bicycle helmets, parents, if you are going to be letting those kids ride a bicycle, you have to be the example as well. We cannot train those kids to put a bicycle helmet on if they're going down the street and mom and dad are not wearing theirs. There is no age limit, and actually just the opposite. Some Suffolk County, New York State, some areas actually have helmet laws, and if a police officer does stop the child, technically the parent can actually get a ticket.
So just looking at that picture too, by the way, that's Muhammad Ali getting hit in the face. But you can see the force that that person is putting on. I don't know who the other boxer is, sorry guys. But the force that's being put, that this person is actually, their head is being moved. So can you imagine taking that over and over again? And this is why it resulted in a TBI. Okay, so many concerns overlap. Ira, you want to take this one?
Sure. So as we've been discussing, and in the beginning with the anatomy, there's different areas of a situation, different areas of your brain that cover different simple situations for that particular geographic area of the brain. However, when you overlap many of the topics, there's a variety of vision issues, sensory, sound, crowds, the impulse control, the aggression. You think of a supermarket as my best example when someone goes into the food shopping and now has a brain injury and has to learn the views of the store, has to overcome the crowds of the store, the noise of the store. Maybe the store was now changed and remodeled because now the memory of them walking in the same route throughout the store to get their groceries by memory is now overcome because they have now changed the store around and remodeled. The kids yelling and screaming, going up and down the aisles, they have to focus on just trying to get those 5 items in their wagon. And that 5 items into their wagon could take a half hour. Because maybe also the person next to them accidentally brushed their shoulder into their shoulder, and now it's a whole big sensory issue because their overextended sensor of tactile defense has risen because of the brain injury as well. So quite often there's a lot of different concerns that somebody might be just focusing on money and shopping, but there's so many other dynamics that need to be looked at. Let's go shopping when it's quieter in the day and it's less crowded, and even if it's at 7, 8 o'clock at night when it's less crowded in the evening. Don't go shopping at the peak time of the day. I just use that as a good example with all the crowds at the grocery store.
So as you can also see from the diagram, TBI has friends. So if one area is affected, it could affect other parts of the brain. So you could have a speech issue and you could have hearing loss. You could have cognitive issues, and then you could have social. So bottom line is there's always friends. Ira, who's that lovely photo?
That is one of my good friends that we go out through Social Brain. He comes on many of our outings, and his wonderful friend that comes along with him all the time. But obstacles of TBI survivors face. As we said before, limitations of executive functioning. The everyday things of, I used to be able to do this. I used to be able to cut the bagels up, have breakfast, toast everything. You know, there's so many different things that people don't think of, how many steps it takes to put a load of laundry in, or how many steps it takes to butter a bagel. You know, there's simple things that we take for granted every day that, you know, somebody with a brain injury, it might take them another 3 or 4 months to relearn how to butter and toast the bagel for a simple breakfast. Anxieties and emotional responses to others, you know, they're the social cues that people may read, or the sarcasm. We may be sarcastic in our everyday life, but to someone with a brain injury, they have to process that sarcasm. They have to process the words of what the sarcastic joke is, and then it has to be understood, like, is that really a joke, or is that now somebody trying to poke fun? Acceptance of their new life and their new disability. You know, I think of also, and family acceptance. I think of some of my individuals who had their children just before their injuries. So their child who was 3 and 4 months old as an infant only knows dad with a walker or only knows mom with a cane or a wheelchair. They don't know any different. They just know that's mom or dad. Versus the child that was 10 or 11 years old when dad got into a motorcycle accident. And now he was up at the hospital every day hoping that, dad would make it. And now dad walks with a cane, which is a lot different from when he used to be at the baseball game every weekend. So there's a lot of different things that, go into family acceptance. The mother who used to be, just a loving mom and now becoming the nurse to do everything for her daughter all the time, every day of the week. So there's a lot of, and even to that, the parent now has to leave their full-time job to become the home care staff member / family member. You also have the concept of my roles of a caregiver, my roles of a parent are now changing. I'm not that loving mother. Of course, they always are the loving mother, but I'm not just a loving mother. Now I have to be that parent that has to be the caregiver as well and nurse.
So also there's decreased time management skills. Now in my line of work, I see this a lot, and there are accommodations for this. I will get into that later. However, when an assignment that you would think would take a minimal amount of time, it could take quadruple the time for someone with a traumatic brain injury. And just being able to organize, because again, your executive functioning is affected. So being able to manage your time, know where you're going, know where you are, these are big things for these people. So not having the ability to do that can definitely affect how an individual would feel about themselves. Ira.
Rehabilitation in traumatic brain injuries. Many of our individuals go to speech, OT, PT, cognitive rehab, and as it says up at the top, the social part that reduces the isolation and depression. That is a big, big factor, and hence why we started the social brain that we'll get into later. But quite often, you can have somebody that goes to PT, does their physical fitness, goes to speech and OT and does their fine motor skills. But when they go home to an empty house. They go home to maybe just a family member that doesn't pay too much attention, or everyone right after the accident says, I'm coming to visit you all the time, and that dwindles away. The socialization, it starts to dwindle away, and they get isolated and depressed that they're sitting at home a lot. Often also is involved is individual counseling. They can get out their feelings, their frustrations. Group counseling, peer support groups. This is a very good part because if somebody had their injury maybe 10 years ago and somebody's relearning how to take care of themselves or accept themselves now in the present moment, the best person to talk to is somebody who went through it years ago. And we try to connect them that way through the social brain and other sources when that comes through. Parent and caregiver support groups, very, very important as well. Again, the parent that did this 10 years ago, 8 years ago, 9 years ago, they went through it. They were sitting there at the one moment of, oh my gosh, this just happened to my son. He was in a car accident. He rolled his car a couple times across the highway. My gosh, what is he going to do? And now that parent can be a support to a new parent that maybe just had their son that fell on a bike and now has to be that new caregiver as well. As we said, the PT, the OT, the speech, the cognitive rehab, those type of things in homes, and then also the day programs. There's many adult day programs out there, but there's also many TBI-focused day programs that work on the everyday programs related around a brain injury. And Lucy, you wanted to talk about the accommodation?
I will. Getting back to the academic accommodations. So part of what my office does is we provide accommodations for students with special needs in general. This includes TBI. What I would recommend for parents, students, people who are considering coming to college, please utilize your academic accommodations. This includes extra time. This includes test questions read, but the main one is extra time. It's going to take extra time to process something. You have nothing to prove. Please take advantage of that resource. It's put in place for a reason. When you come to college, or if you're inquiring about college, the first question you should ask is, where's the disability office? Because that office is what's going to provide the support that you need. And as somebody with disabilities, believe me, it is important. So, supporting a TBI survivor, what can we do to help with the process? So, Ira, let's share. You go first.
Well, the most important thing I think of in any person, whether they're cognitively able to speak, is speak to the TBI survivor in an age-appropriate language. This is my biggest thing I tell every new staff member, all the families that I work with. It is so important for them. They may not have the communication abilities. They may not have some of the cognitive abilities may have been lost, but they are not a child. If they are a child, that's different. But if you have a 24-year-old, speak to them as they're a 24-year-old. And that's the biggest thing. They deserve that respect before they do anything else. Speak about the environment for them to gain an understanding of their surroundings. You know, talk about the weather. In the beginning, it might sound like you're over-talking, but you're not, because they are needing to take in all that stimuli. If you're sitting by the window and you're talking about the weather, and they start to connect the dots and the nerves of, oh, it's sunny and I'm hearing the word sunny, or it's raining and I'm seeing raindrops and I'm hearing the word raindrops, that's where it is. It all talks about their surroundings. Talk about the weather, the day of the week, the news. Put the news channels on. Put things out that way. Be supportive of the caregivers. Caregivers, every family has its own background. Some families are very, very involved. Some families are distant. Some families themselves are going through the grief and the acceptance that they lost their daughter or they lost their son to this major car accident and they can't go out anymore. They can't be home much on the weekends because they're now being the caregiver. The use of calendars, planners, phone apps with memory skills. Quite often the memory of not knowing where all the appointments are and stuff. Use a planner, use calendars, use small ones that they can bring on all the appointments. Important thing, allow the person time to process the receptive language and give back expressive language. So important. We said before about the time. The time is, again, time and patience. You can ask a person a question, a person should be able to answer it back. They are needing to process what you just said to them, understand it, comprehend it, and then on the flip side, try to figure out the words to get back to you. All within a few minutes.
So just to clarify, receptive language is what's already in your memory. Expressive is what comes out. So when we're learning something, we're connecting expressive to receptive. So that's why these people struggle with that. Sorry, Ira, continue. Speech to text.
No problem. The speech to text apps are great because they may not be able to speak full words, but if you speak the speak app to them on their phones, they give them time to build an understanding, build a language vocabulary pool of words that they can build upon. A fine example is I have a gentleman that I work with severe aphasia. We started this speech-to-text app about 4 years ago. He was using 1 and 2 words. Then I gradually went to about 6 or 7 words to now I can put 3 or 4 sentences in a text app of what we're going to do for the day, and he will read it, comprehend it, hit the button, and the phone will speak back to him. But about 3 or 4 years ago, we were on about 3 or 4 words, not sentences. Build routines. So important with the individuals with a brain injury. They can build a routine. They can build an understanding of what is needed for the routine to follow through, and they can have that self-gain and self-independence as they complete tasks during the process of the routine. Again, I use the grocery store as a fine example. I have a gentleman that I work with that has gotten to the point where he has the grocery store memorized. He cannot speak, he has trouble writing, but he does have a very good memory part in that sense. He has memorized his grocery shopping list. His routine is that he buys the same foods every week, except for some little things on sale, and he actually walks the same route in the grocery store itself. I can get to checkout now with him at the end of a couple of years working with him, look in the wagon and tell him what items he missed, because he buys the same items every week. And then, has the specialty items. So again, building that routine. If I picked him up and put him in a different grocery store, he wouldn't know what to do. Encourage individuals to register with the disability offices, as Dr. Lou said, accommodations at school, follow your 504 plans, and ask for the help when possible.
Yeah, there is no shame in asking for help. You already have all these different obstacles you have to deal with. Allow people to help you. But back to that first bullet that Ira was talking about, 100%. Speak to the TBI person as though they are age appropriate. I have seen people that they are literally spoken to like babies, and you could see it upsets them tremendously. So be aware that these people have feelings and they don't need to be treated less. They already feel less. So try to take that into consideration. Getting back to the use of the calendar and planner, I had a student who literally made a roadmap of the college, walked it for 2 weeks straight, and documented every turn, every single thing. Also, same thing, utilize that medical reminder and alarms. Ira is 100% right. It reduces so much anxiety. It's on them all the time. There's ever a question. Ira, didn't you mention something that their doctors can also have access to this information a certain way?
Yes, there are some apps out there that even if you put it on your phone and your phone is locked with a passcode, there's actually a couple different medical apps that actually will go and bypass the locked part of the phone. So if you go to an emergency room, you can actually hand the phone to the worker and they can hand them the thing. And just an add-on thing with the building the routines, the other good thing about building the routine, I use the grocery store as an example again, is not only did that gentleman build the routine of shopping the way he shops, but the staff that are in that store have built a rapport with him and know him, and he's built a little bit of a rapport and a little bit of an understanding of his community members, and they have been accepting of his disability inside of their grocery store. And they now know, that he is limited on his speech and he doesn't speak much. And if a new grocery store staff is there, the older ladies that have been there for a while with him actually share some of the knowledge about his disability in a positive way to help him out during shopping.
All right, moving on. So we kind of touched on this a little bit, but Ira, why don't you get into a little more detail of how people can be independent?
The technology for brain injury. The technology for brain injuries is a great way for individuals to rebuild their independence and communication. It allows them to build their independence at their pace. There's no rush, and we as the providers and families and caregivers need to work with them at their pace. Sometimes it's okay to give them that little push and nudge so they don't sit dormant in one little level, but let them work at their pace. As we said before, the speech-to-text app allows the conversation to stretch to full sentences, push the survivors even more during difficult times. Once they get past those couple words, push that extra one sentence and see if they can do it. You don't want to set them up to fail, but at the same time, you don't want to sit there on 3 or 4 words when you know they can actually answer full sentences. Language apps, connect them to the appropriate ability level. Everything's technology out there. iPads, iPhones, Samsung, Android. They all have different free things that you can just look through your Play stores to find. The plug-in reminders on the phone, alarms. This is important. If you put the same tweety little sound on the phone for every alarm of 4 medications and I have to go to the doctor and everything, they're all going to eventually be blended. Put a different sound for different meanings. Maybe medications is a doorbell. Maybe a doctor's appointment is a Tweety bird singing, or maybe a chirping noise. Put different sounds for different meanings. because this way they can then associate, oh, the chirping, what's that mean? Oh, that's a medication time, I have to check. Something like that. Save the passwords on index cards. Or also text them to a close family member, friend, to save on their phone. Keep in their contacts. Quite often you'll see on, even if you open up your phone right now, you'll see your name, your email, your phone number, your second phone number, your third phone number. Use those lines. You don't actually have to put those lines in there. I've taught many of my individuals to use those lines as it says, it'll say front door, if somebody has a passcode for the front door. And then in their phone, under front door, we put the code for the front door. So there's simple things like that. You can also register with your Office for Disabilities in the county so that they know that there's a person with a disability in that site. You can call the local fire department if they have any medical equipment. If they have life-saving equipment, you can call your local electric companies as well. Let the community know.
And many of the apps that are on these phones, at least the smartphones these days, are free. So we encourage you to please look into them and even provide us with feedback. We're always interested. Right, Ira?
The New York State Department of Health TBI waiver program. That's where I work with many of our individuals on the TBI program. It is a Medicaid program inside the state of New York. So this is a national website webinar right now. So if you are listening from outside of New York, please look into your own local state and county TBI services inside your state, wherever you might be listening from. We're not sure where our visitors are all come from tonight. So some of the programs that we have here in New York include independent living skills. It is called the ILST. That will work with an individual on cooking skills, food shopping skills, banking, money support, financial support, writing out the check for rent, scheduling your doctor's appointments, working with your calendar. A lot of life skills that will be done to retrain on like everyday programs. But not doing it for you, however, doing it with you and training you to relearn what you can do. Positive behavior intensive support is basically a behavior specialist that works on frustrations, anger management, impulse control, peer support, family dynamics, things like that, that all really fall under, the behavior, how to work on your best behaviors to work on some frustrations now that you have an injury. CIC is your community integration counselors, which is basically, in another sense, like a social worker, that you get a one-to-one session once a week where somebody can come to your house and set up, a time that you can just talk, more of a social work counseling session that you can talk about your direct frustrations. And it just helps them, sometimes you can bring in family or children, depends on every family's situation. Structured day program, they're local day programs based on abilities and interests. Some are a fun social drop-in. They have different fun activities. Some are very structured. We have one here on Long Island that is very structured, almost to the setting of like a school. And here on Long Island, we have the very first vocational-based day program that is first on Long Island and possibly first in the state here on Long Island and Bethpage. And they learn their main purpose for the entire program is vocational-based, writing resumes, doing practice interviews, getting volunteer jobs and stuff like that. So they're not really a social drop-in. They have a focus on the vocational part. And one bonus, which is such an important part, that many of the individuals after their injuries, they need the rehab. With the New York State Department of Health waiver program, there is no cap. Many insurance companies say, oh, we'll give you 20 sessions of PT. Well, you can go 350 days a week if you wanted, because we do have people who actually go to PT, OT, and speech 5 days a week, sometimes 4 days a week, and they can go year-round. There is no cap on the waiver.
Hey, I know that guy.
Oh, and I have the shirt.
You do.
Some of our Long Island resources here on the island include family residences and central enterprises, the Head Injury Association, New Beginnings Community Center in Medford. That's a program where there's a day program setting. There's also OT, PT, speech, and community support that way under one roof, and they have different entities that can help out. Multiple hospitals, Southside Hospital, St. Charles, Stony Brook University, Stony Brook Southampton Hospital, our organization called the Social Brain, and we also do have the U.S. Department of Veterans Affairs at the VA up at Northport. So there's a lot of different resources here on the island, and I'll get into the Social Brain in a little bit, but you have to find your resources of where you live. If you are outside of Long Island or outside of New York State, you can, Google is wonderful, so just, jump on the community pages, see what you can find, network, ask questions. If you're at a neurologist's office, ask at a neurology office. They can at least lead you in the right direction.
All right. The Social Brain, go.
The Social Brain, very happy to be part of this program. As we said in the very beginning of part of these slides, that some of the biggest things is the social isolation, sitting at home. Many of our individuals that I work with, I work as a behavior specialist, and as their biggest concern, and as well as the family, was that they can go to a day program 5 days a week, they can go to OT, PT, speech, cognitive rehab, but when they come home, there's nothing to do. There's hard ways to get out into the community. There's not much socialization. All those friends that, 20, 30 friends that all came around the hospital because they had gotten into a major car accident. Oh, we're going to come take you out every weekend and all this stuff. And a year later, they're down to like one friend that visits about once a month. We created the Social Brain. It's a nonprofit for brain injury survivors to build friendships within the community, community recreation programs. We have been doing programs including nature parks. We have done a bowling program. We have done art nights. We have done picnics and barbecues, picnics a couple times. We did a few of those. We did a day with the horses with a local horse farm that allowed us to come in and integrate with the horses, do some range of motion, petting, grooming, and just really enjoying the horses, but no riding. We've started to work with some of the local high schools, doing some talks on helmet safety, as that is a big part, very important part, because helmet safety starts with the younger kids. And, when you have those kids like, oh, I don't need a helmet, I'm cool, nothing's going to happen to me, and they fall. And the first time might be scraping up their knee and bumping their head. And then the next time could be a deeper cut on the knee and a harder hit. And one time could be when they are in the hospital. So we've been working on those types of events as well, trying to get the community to know that we are out there and how important it is for the program to understand helmet safety. The important part is that of the Social Brain is that I'm a professional in the field. However, there's other professionals in speech. There is OT, PT on our board of directors. There are families on our board of directors, and most importantly, there are survivors on our board of directors. Our community started in this September. We started meeting literally at a local restaurant just to get some planning ideas down. We sent out flyers to form the program, and then from there we launched this January 2019, and we now have a board of directors of approximately 8 or 9 individuals from different fields.
Just to let the audience know, the pictures that we've shown on the slide are actually people that Ira gets to work with. So you can see there's one image with the horse, which is the horse grooming, and there's the picture with Ira. And is that your board, or is that just?
Yes, that's our board. I don't think it came through yet, but it will be there. Okay. And we had the opportunity to, meet a couple of local politicians that, helped us out. And, it's just the biggest thing is that it's there to have fun and build friendships and build that connection. One story I can easily share is that we did a bowling program. We started off with reserving 4 lanes. I figured maybe about 20 people would come. Well, 42 bowlers later, almost 100 people at the bowling alley were registered, and we ran out of room on a good way. We ran out of room at the bowling alley. One of the family members that were there, her husband was helping and bowling and having a great time, and she said it was the first time she saw her husband smile and laugh in about 2 years. So, you know, that's what it's about, making the smile.
So check them out on Facebook. All right, so we just wanted to provide you with some website resources, the basics, American Stroke Association, American Foundation for Suicide Prevention, because as Ira said, we don't really want to discuss it, but we need to. Brain Aneurysm Foundation, Brain Injury Association of America, that's the big one. Center for Disease Control and Prevention, another big one. Family Residences, Essential Enterprises, which Ira is with the Social Brain. National Stroke Association, and yeah, so moving on. Again, thank you, Erin. She provided us with these resources. The VA has their own brain injury center, and the second is a Senator, Kirsten Gillibrand. She is a Democrat who is very supportive of the military. So you can check out her website. She is giving resources for how to provide better treatment for veterans who are suffering with TBI in addition to PTSD. So to wrap it up, overall, TBI, we're learning about it. Thanks to organizations such as IRA and the Social Brain, these people are getting the support and love that they deserve. And thanks to our athletes and military, the awareness has grown exponentially. And it's important to realize that these people have so many obstacles they have to deal with by the minute. And if you've noticed throughout this entire presentation, we keep saying the same word over and over again, which is time. Give them time. Understand that they are processing things differently than you and I, which is important to help them be the person that they can be to the best of their ability. And
Dr. Lou, I'm going to share one thing about giving something time. We had a individual who worked so hard, who did not speak anything. He spoke no words. He would nod for yes and no. He would nod for some other questions. It took him many, many times, many years to work with a speech therapist, and he started talking after 10 years. He said his first few.
I love happy stories. So the last bullet, awareness is key. I encourage you, even if you don't know somebody with a TBI or you don't have one, check out those websites, learn a little bit more about the subject, because chances are you have already encountered somebody with a TBI, whether it's minor or major. But being in the know allows us as a society to grow and evolve and embrace each other. So that'll wrap up our presentation. Do we have any questions?
Thank you, Lucianna. Thank you, Ira, for this amazing presentation. And as people are thinking of their questions, just as a reminder, please feel free to type them in the question box. We'll make sure that your questions get directly to Ira and Lucianna. And actually, the first question that we have is here. It says, why do you think socialization has been so grossly overlooked for individuals with TBI?
I'll start with that answer, and Ira, you could help me too. It's important because it's been overlooked because there's a stigma. You know, most people associate a traumatic brain injury with someone who can't function. I mean, if I'm going to be blunt about it. So the idea of socialization, some people think, oh, they don't even have the ability to do that. And that is probably the #1 reason why it's been overlooked, because society has their own perceptions. You want to add to that, Ira?
Well, close to what Dr. Lou was saying as well. Quite often, you know, someone gets into a car accident and they're in the hospital and they're closing to discharge and rehab. That's what they're working on. They're working on rehab. Let's get that PT to push those legs. Let's get that OT to work on those fingers and those hands, the speech so that can talk and have the cognitive abilities to respond and express. When then after all those rehabs are done, they're back in their rooms and at night watching TV by themselves. And then they deteriorate a little bit more because there's no stimulation from just socializing, having fun, enjoying. Sometimes you're playing kickball with your friends, and they don't even realize you're playing kickball with your friends because you're just having fun.
So basically, they have a bad rap, and that's why socialization has been overlooked.
That actually leads perfectly into the next question, which is, how may we as a society or as individuals, how might we be stigmatizing this population without even knowing it?
Well, oftentimes with invisible disabilities, a traumatic brain injury, it can be an invisible disability unless you see other disabilities within it. But learn, get the resources. That's why I encourage you. I mean, I personally do not have a TBI, and yes, I am in a position where I deal with disabilities, but I wanted to learn more about it. I looked up, YouTube has great videos on survivor stories. It breaks down how to speak to a survivor, how to help promote a healthier lifestyle. But oftentimes, again, you may not be able to tell the difference. I mean, that person with the TBI may not be able to tell the difference. They may be in denial. So as a society, knowledge is power. Ira, is there anything else you can add?
I think just again to piggyback off of what Dr. Lou said, the physical disability, somebody's in a wheelchair, somebody's walking with a heavy walker or crutches, they see it. Somebody's blind, they're walking with vision impairments, they see it. Quite often the stigma is that, well, if they don't have a disability, why are they parking in a handicapped parking space? And they don't need to walk there. Well, do they know that the person has severe migraines if they walk more than a certain amount of feet, or the loud noises of the store really can get them their sensory overload, or the memory, speech. The person may be totally fine. I actually have an individual, he has no physical disability. You see him in the community, you would not know anything. If he opened his mouth to start talking, he is very limited on his speech. And that's where people are like, oh my gosh, you have trouble talking.
Mm-hmm.
And they only realize that after he starts speaking verbally to them.
So don't be so judgmental. Learn about the topic. If you really want to make a difference, learn, research, and implement. And there's
volunteer.
all these different, yeah, go ahead, what?
And volunteer.
Yes, thank you, Ira. Volunteer. Is there another question?
Thank you both. Thank you both for that. A few more things coming in from our audience, and thank you again to those who are logging on and putting in your questions right now. We really appreciate it, and we're excited to hear from you. We actually have somebody here who logged in. Her name is Diane. She's a survivor and a neuropsychologist, and she actually wanted to let us know that she has a book covering the various symptoms of TBI and various treatments, including conventional, complementary, and alternative, plus practical suggestions. So we're going to be connecting you with, Diane, we're going to be connecting you with Dr. Basilice-Tieniber and with Ira after the webinar. Thank you so much for that, Diane, and we're so happy that you can be with us today. Another question here. Have you seen an increase in TBI students advocating for themselves in the college realm? And is there a program at St. Joseph's College for TBI students?
It's not that I've seen them advocate, because they don't normally advocate and say, hi, I'm TBI. Usually they will hand the paperwork. Have I seen an increase of it? Absolutely. However, again, it's usually masked with other disabilities. As we said earlier, disabilities have friends. A TBI tends to have friends. So when I see it, it's usually written down as LD, ADHD, or some other diagnosis. So yes, there's an increase, but they're not being forthcoming right away. I've actually had I've been at St. Joe's for 3 years. I've had about 10 students fully disclose their traumatic brain injury. And it's usually, thank goodness, they are explaining to me how they need more time to do things. And I've been fortunate enough to actually have some of them explain their situation to me. So as far as the program, We don't have a TBI program per se. We have an all-inclusive program. Being somebody who has multiple disabilities, TBI is not one of them, but being on the spectrum is, I wanted to develop a program that includes all. So that program caters to cerebral palsy, LD, ADHD, dyslexia, dysgraphia, TBI, you name it, we take it. So that program's the PASS program. In that program, so let's say we had a TBI individual. Part of their program plan would incorporate a memory journal, knowing how to put in alarms in the phones, not basic life skills, you have to have that coming in, but studying strategies, being able to maximize on your attention span as long as you can without it being painful, because again, we want you to be able to absorb. There is a socialization component within the program. We don't necessarily go out and about, but all the students, I have to say, they're very family oriented. So right now we have 22 students who are going to be in that program. Each person develops a friendship with a different student. So there's not one type of disability ever mingling with itself. They're all together, so they could all discover different things. And often, as I said, with TBIs, you see different things such as LD. So you could have a student who's talking to a TBI survivor, but they're only looking at the LD. And they're not thinking of that person as a TBI survivor. They're just thinking of them as a person, which is the whole idea of this program, is that we can support each other. So I hope that answers your question.
Dr. Lou, as an alumni myself from St. Joe's here, and, I love the college. It's a great college and the programs that you're doing. I second all the programs that, have everybody inclusive of different disabilities to learn from each other, because even a disability is different from one person to another. If somebody is interested in trying to do a WAIVER program, going to do that far-fetched, I'm going to go away as a full living on-campus concept. The only program that I do know of is SUNY Plattsburgh has a program for brain injury survivors on campus at SUNY Plattsburgh, and they have they have a specialty program where they have, I think, part of the buildings even fully accessible for the wheelchairs and everything on campus in the living dorms.
Thank you both. And that is the end of our webinar presentation this evening, everyone. We'd like to thank all of you who joined us this evening. I'd like to especially thank Dr. Lucianna, Basilice-Tieniber, as well as Ira Dunne for joining us. And on behalf of St. Joseph's College, on behalf of the Office of Alumni Engagement, we are thrilled that you were able to take the time and share your expertise with us. Not only that, but for us to be able to provide this resource as a valuable piece of information for the community. This webinar is recorded and will be featured on our Alumni Video Vault. You will be able to access it at any time, and we will let everyone know when the webinar is available. At the conclusion of this webinar, you will see a survey pop up on your screen. We encourage you to please fill out that survey. We love to hear all of your feedback. It really does help us inform future programming and workshops, and we know that our facilitators love your feedback as well. Thank you both so much for joining us this evening.
Thank you for having us.
It was a pleasure.
Thank you. Thank you, everyone. Have a great evening. Thank you.